I'm very grateful to be here, guys, with you, just talking and sharing this topic with you today. And let's say that today we want to focus right now in the crowns that are performed in a natural tooth. Because we have the implant crowns, but right now that is another topic for another webinar. So right now let's talk about crowns. What is a dental crown? Okay, guys, a dental crown is a tooth-shaped cap that is placed over a tooth. So, what a dental crown can be restored, it's like, they can restore the shape, the size, and the function. It's like that. It's like crazy. Okay, crown restorations. The crown restorations are the most common dentist procedures that dentists perform. We made a lot of them in Sani Dental every day. And it's very common for us. It's one of our top dental procedures. Actually, I mean, right now, actually, probably you have one, or maybe if you are in your middle 20s or your 30s, your 40s. So probably you have one, two, or maybe more. So it's pretty normal. Okay, why is a dental crown needed? To protect. Okay, well, to protect, when you have had a root canal treatment, you will need a crown. So the crown will protect that tooth. To restore when one of your teeth, I'm sorry, it's a crack or a decay, that are going to restore the crown. The crown is going to restore. So, and to cover, when you have a cavity that is long, and we cannot, it cannot fill with a resin or another material, so we can cover with a crown. And also, when you can change the size or the shape, that way we use a crown to cover it. Okay, let's talk about the crowns that we are using here in Sani right now. We have 3 types of materials. I like to talk about all of them. So let's see. So here, let's talk about the materials, because that way, if you are thinking to come to Sani, so you can be more knowledge about the materials, and if you decide to come with us, I mean, you have an idea what do you want, or what material do you want for you. So, okay, this one, I like this one. So it's the porcelain fused to metal crown. Okay, this one is the most common crown. So it's very strong, and we recommend this type of material for the back tooth, because it's strong, but it's not the most cosmetic one. So, but the middle base make the bite very strong. So we use it a lot, and right now in Sani, we are requiring 3 full days to make, even if it's 1 or 28, you should stay in town 3 days. Okay, this one is the zirconium crown. This one is my favorite one, because in the market right now, the zirconia crown, it's made by a ceramic material. So it's very cosmetic, and also it's very strong. So it's very functional. So versus the porcelain fused to metal crown, it's the porcelain fused to metal crown is more affordable, and the zirconia crown is most cosmetic. But so for example, when we finish this type or crown, and we are going to make the cementation, so you cannot see any metal line between the gum and the crown. So it looks, fits very perfect. So, and that way seems like it's your own tissue. So that's why these type of crowns are made recommended for your back tooth, or also the front teeth. So it's very, very cosmetic, It's a little more expensive, but because you have like, you know, more it looks like more natural. So, and we are requiring 5 days to make these ones. Okay, this one. I like these ones too. Like this, the IMAX crown that is the full ceramic. It's very cosmetic. Right now is the newest material in the market, guys. So, for example, if you're looking for a total makeover, or if you want like that very, like, for example, if you work in an entertainment business, or probably if you want to look like a model or something, or you are working in TV or something like that, this one is for you because it looks like natural and it's very pretty. But the thing with this one is that it's not so strong. So versus the zirconia and the porcelain fused to metal. So, but that's way that is because only recommend for the front teeth, and we are requiring full days in Sani. So you should stay 4 days in town to make this type of crown. Can we see the next one? Okay, guys. So, okay, I like to talk with you about the process of how we make crowns in Sani. Um, so let's see. Okay, the first visit. If is this is your first time in Sani, you're going to see our diagnostician team. So, and then they are going to take a panoramic X-ray. This is very important because we want to check. We want to check like your roots, your bone, the nerve, if you have any cavity. So also if you have any infection. So it's very important to take that panoramic X-ray, and but everything goes well. And after that, you're going to be assigned with one of our specialists, and the specialist can start working with you and start the process that is of the tooth preparation. And after that, they are going to make like impression, and they are going to send that mold to the lab. And it's very important to say that Sani, we have our own laboratory, so that way we can work faster and with more details, because it's like the communication is very close because it's just like there. And so after that, you are going to get your temporary crown. So let's say that the temporary crown is made by acrylic, so it's not strong, it's not to bite, and it's not to eat. Honestly, it's just to socialize, and and it's going to be just there. It's made as just to be there like a couple of days. So, okay, the second visit. Thank you. So this visit is my favorite one. I love this one because this is the fun visit, because it's all about the cosmetics, uh, collection. So you and your doctor will make the color selection, and for example, if you want to make a change in the color of your smile, here's your time. So of course, your doctor will advise, but if you want to like the super white smile, this is your time. So it's going to be a short appointment, probably 1 hour, and after that, let's see the other. Okay, and this one is going to be the last visit. Is the third visit. The third visit is for adjustment and for the final cementation. Okay, so in this visit, the doctor will check that everything fits perfect with your crown. He's going to check that we don't want any hide spot. We will eliminate any hide spot. So we will check your occlusion, and also if everything goes well, we are going to make the final cementation, but uh, everything needs to be fine with your bite, okay? So, and after that, the final cementation, let's go back, the final cementation, and you can back home and you can eat normally. You can start eating normally, and you can start eating, using your crown. So if you want to eat steaks and burgers and all that stuff, you definitely can do it. So I love this. I love this case. Okay, let me talk. Let me talk about it, guys. Let's see. I I totally love this case because I coordinate these patients personally. So I received her email, and in her email, she told me like she was not happy at all with her smile. She was like sad about it, and we start to coordinate the trip to Los Algodones. So this is a patient from Canada. She's a woman and middle of 40s, and as it's very clear, then we can see here, guys. Let's see. For example, we have cavities that is very clear. We have some periodontal issues like the swallow, and you can see the bite, like the evolution is not okay at all. And also the color it was yellow. So okay, and so one of the specialists took this case and started working with her with zirconia material. And as you can say, you can totally change your smile with a crown. And you can make just a full mouth restoration, and that's amazing. You can just make a makeover with a crown. And as you can see, we the specialist changed the color, changed the size, and changed the shape. So the patient was very happy and made a very, very good review for the doctor. And so as so I'm very happy to talk with you guys. And right now in this before and after, you can see how you can improve your smile and change your life. So thank you for listening to this. And okay, right now we can start. I mean, if you have any questions, we can start questions and answers section. Thank you, Fernanda.
Perfect. This is your time, guys. In case you have any questions and you would like some answers, of course, you can post them here on the Zoom platform. I actually see a question that they left on the chat. You might be able to see it. It's from Rob, and it says, this is a very common question. Is it possible to cross the border for crowns? And how much lead time do you need?
How much? Excuse me, can you repeat
How
that?
How much time do you need for the crowns? I see. How much lead time do you need?
Okay, so right now that's very important to say right now in this time. Yes, dentistry right now is considering like medical procedures. So yes, you'll be able to cross the border, and also Sani right now can provide a letter for you, so that way you can be sure that you can make it to your appointment. And right now it depends like what type of material do you want. We talk about 3, right? So I don't know what is better for you. We say like porcelain fused to metal is three full days. So for zirconia crowns it's 5 days, and for full ceramic it's 4 days.
Perfect. And it says that if the webinar will be recorded, yes, guys, the webinar is now right now being recorded, and we will post it on our social media platforms to you guys. The people who were not able to see it today, they will be able to see it in many other days. And I actually see another question. How big is the difference in price between the porcelain over metal and the zirconia crown?
Oh, very good question, because I did not mention it. Thank you so much for reminding me. Okay, so for the porcelain fused to metal, it's Insani is $180. $6, and American dollars. And the zirconia crown is for 450, and the IMAX crown, the full ceramic, is 340.
Perfect. Okay, we have another question from Scott. It says, is it the same number of days for a full mouth restoration?
Can you repeat that question for me?
Yes, I think he refers for the crowns, but is it the same number of days for a full mouth restoration?
As I said, and even if it's one crown or 28 crowns, the material is the same, because in our laboratory, the crown has a process in the oven and all that process. So if you pick like the porcelain fused to metal or zirconia crown or the full ceramic, it's the same day if this is 1 or 28.
Perfect. We have another question. This is an anonymous attendee. It says, can you get more than one type of crown for a full mouth makeover?
Oh my God, that's a really good question. Thank you, guys. You're doing great with the question. Thank you. Yes, actually, yes. For example, in Sani, we have cases that we can use porcelain fused to metal in the back molars, and that way you can get a strong bite, and you can save like a couple of dollars, but you want very cosmetic smile in your front teeth, so we can use zirconia crowns there. So we can use porcelain fused to metal base in the back molars, and in the front teeth zirconia. So you can get very, very good results.
Perfect. We have another question from another attendee, Wayne. He's asking, are pain medications available, and will short-term antibiotics be recommended?
If we prescribe, that's
pain medications. I think it's for the crowns too. Are there pain medication available? And if short-term antibiotics will be recommended.
Okay, so antibiotics are not recommended if you don't have any infection. Even it's just if you have any problems with the nerve or with some periodontal problems. Only the doctor can say that. You cannot prescribe it by yourself. And in some cases, when we are working with the tooth and the high speed hand can sometimes cause a little bit of pain, So, and we can use like pain medication, but normally it's not a painful procedure.
Okay. We have, how long would the visit to get all your teeth done is coming from another country?
Oh, I'm having some problems with I'm sorry. Can you repeat that question?
Yes, no problem. It says, how long would the visit be to get all of your teeth done if coming from another country?
Oh, okay, guys, I got it. So, normally we are recommended, for example, let's say that you want, full mouth restoration with porcelain fused to metal, that it's 3 days. But if you are going to make the trip from another country, and we want to make this the best, the best for you. In Sani, the quality and the client experience is very important to us, because most of our clients are not local clients. We are experts in medical tourism. So we recommend, honestly, like a week. So that way you can give us a little bit more time, for. So if you want to change any detail or something.
Perfect. Okay. Well, they're asking when will be a webinar about dental implants, Dr. Marla.
Oh, wow. Thank you, guys. They're making a great questions. I think it's going to be okay. Please, guys, if you're happy with this webinar, please let us know. Let us comment and give us your opinion. For that way, you can give us a lot of ideas to know more webinars. And yes, I think it's going to be the next one.
Okay, we have another important question for every Sunny patient that comes. Where do you stay when you have to be there for multiple days?
Okay, right now we are working with 2 hotels in town. So, okay, see, the information that I have, I mean, I want to talk about this. We coordinate the trip, so that is great. You can call, to Sandy Line, and you can get a patient coordinator, and he can explain all the benefits to come to the advantages of to come to Sandy. But we work with 2 hotels in town. One is Hacienda, and the other one is Cielito Lindo. So you will be in a good hands, totally.
Okay.
See, it was that question, right?
Yes.
Okay.
Where were the hotels were you able? We have so many questions. Thank you, guys. Okay. How many hours is the first appointment and the third appointment usually? And the second one is different too, right? How many hours?
Thank you, guys, to make these amazing questions. Oh my God. Yes, the first one is going to be the longest one because we are starting all the process, and so probably if everything goes well and you don't have any infection and just go directly with the tooth preparation, it's going to be around 3 hours, I think so. And the second one is the fun one. So it's like around 1 hour. And the third one, so probably if everything goes well and your crown is fits perfectly and wears perfectly with your tooth, probably it's going to be 2 hours.
Okay. This is a very interesting question. Can you replace existing crowns over implants?
I'm sorry.
Can you replace existing crowns if you have a crown over implants?
Oh.
Can you change a crown for a dental implant?
Yeah. Okay, got it. Yes, totally. I mean, if the implant is still in a good, we need our X-ray to check if all the, your bone, your gum, if everything goes well with the implant, we can replace the crown. And of course, you just going to pay for the crown, not for the implant.
Okay. Okay, what if eating normal foods after a few days or weeks, the original bite adjustment needs adjustment? Yeah. And if it happens often, the readjustment?
Mm-hmm. So, yeah, that can happen because when you change the shape of the tooth, it takes a little bit to adjust. So probably your jaw is going to do a kind of movement, and we need to make that. Sometimes it's like in the first in your third appointment, we're in the final cementation, and we eliminate the high spots and and it fits perfectly. But sometimes when another patient, sometimes we need more than one adjustment.
Okay, we have a fun question, and it says, can you walk us through the process from arrival to the border? If it's the first time visiting, this person has never been to Los Algodones, and it's a little bit nervous that he or she would get lost. This is an anonymous question.
Okay, this is not a medical question, but I'm so happy to respond. So, yeah, we can do that for you totally. We understand that when it's your first time, you're coming for to another country. So, but we are like we have like 25 years in the in the business. So this is like our every day for us. So yeah, totally.
Okay, I see a very important question too. Marla, when you get all your teeth done, do you still need a regular teeth cleaning by your dentist?
That depends. Very interesting question. It de- when you make when you change all your when you made a full mouth restoration, I can say like no because your crowns are new. But if the doctors say that you need it, probably yes, because it can be some in the gums, and or sometimes in the cementation the material can get stuck, so we need to make a regular cleaning.
Okay. We already have this question. Okay, we have another question about implants. It says, if one wants to get a full mouth restoration and they have a few teeth missing, would they need to get implants into the spaces where the teeth are missing first? Or maybe if they can get a crown on those missing spaces?
uh, if Okay, what happened when you're missing
Yes,
a
if you want
tooth?
to get a full mouth restoration and you have a few teeth missing, would
Mm-hmm.
you need to get implants into those spaces?
Yeah, understand. Yeah, we definitely recommend implants, to get implants, because it's better. Because right now it's more like your natural. It's just like you have your own tooth. But sometimes you can make. I mean, if we have the other tooth uh, in the sides, we and you can make the full mouth restoration. You can make a bridge, but if you're going to make if you want to make an implants and full mouth restoration, I highly recommend that first the implants. That way, at the end, your bite is going to be at the same, and we can take the impressions and send the laboratory and make the at the same time.
Okay. And can you put crowns on teeth that are calcified?
Yeah, that well, sometimes what happened with that those types of food is like sometimes we cannot make root canals, but crowns definitely.
Okay. And it says, well, some people are not allowed to travel right now, but will Femi honor the warranty for the crowns that they have?
uh, I mean, yes. I mean, we have 2 years guarantee for most of our treatments or dental
Okay,
procedures. Hmm.
perfect. We have so many questions, Dr. Marla, and a lot of comments of people wanting to get to have a webinar for dental implants.
Oh wow, guys, I'm so excited.
Okay, and it says, how long would you recommend staying for a full mouth restoration that is mostly zirconium?
Yeah, yes,
Will
zirconia.
they likely be more adjustments? And if the first visit would still be 3 hours, if it's a full mouth restoration.
Yes, 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 because the process is the same for if it's going to be it doesn't matter the material, the truth preparation, the impressions, and your temporary crowns. So it's going to be the same process. So it's taking a little bit longer because the process in the laboratory, for the process of to make the crown, but to so yeah, the first appointment it would be like around 3 hours, and for zirconia crowns, full mouth. Oh my goodness, I think. I think at least you have to give us a week, guys, please. So
The 5 complete days.
yeah, right now we are working Monday to Saturday. So if it's going to be a zirconia crown and it's going to be, for example, let's say 28 tooth, I mean, all your teeth. So yeah, I mean, because we are requiring full days, but at least you have to give us a lot of one more for because you're for another country. We want to give you the best experience, and we want to be able to check that everything is that you can go back home like with your perfect bite.
Perfect. Okay, interesting questions. Can you choose what doctors do you want to have? Because there's just a lot of doctors. There's a list of doctors on the website. Can you choose the specific one?
Thank you guys. Thank you guys. I was missing to say that, but we have all the specialists in every single area. That is so important to say. We are a big team, like we are 40 doctors, and we have all the surgeons, the periodontics, the endodontics. So yes, and we have all the profiles there. And if you pick a doctor, just let your patient coordinator know, and the patient coordinator can make a note. And if that doctor is able to see you, yeah, definitely you can have it.
Okay, I have a personal question for you because they're asking for price of the root canal. I'm not sure if you have the information, but we were discussing a little bit earlier about what happens if you have an infection and if you are able to have a crown. Can you tell us a little bit about it?
Yes. Okay, the only thing. Okay, of course you can have. I mean, if we can save, since if the infection is not like, you know, if it's we able to save the tooth and not make an extraction, and the only thing that is going to happen in the process is like you have to get first the root canal. That is going to take another appointment. So the root canals are made done like in one appointment, but it's going to be around 2 hours.
Perfect. Okay. Let's see what other questions we have right here. Okay. For an implant crown, is the process and the cost the same? For an implant and the crown, is the process and the cost the same?
For the normal crown, for the and the
and an implant.
Implant crown, of course, it is not the same price. No. I mean, sorry guys. The implant, yeah. So we use a different tools, so that is a little more complex, and they are made by a specialist. So yeah, they are a little bit more expensive.
Okay, and what about the time? Is it the same between an implant and a crown?
Mm-hmm. Yeah, for the materials, yes, is the same. It's the same.
Okay. Let me see. Okay. If a person already knows what they want, do they still need to get an x-ray and a consultation first?
If it's going to be your first time with Sammy, yes, because our diagnosticians team needs to make. I know, guys, that you have sometimes because I can as my consultant in Sani Dental, I receive a lot of dental treatment plans that from your local dentist, and sometimes you want to get that. I totally get it, but yeah, sometimes I mean, our diagnostician team needs to take an X-ray. Is it going to be your first time in Sani? Because we need to check that everything is well with you.
Okay, this is an interesting question. In a full mouth restoration, are each of the teeth be able to accept a new crown? Or how are the current teeth that you have prepared for accepting the new crown?
Can you repeat that question, Fernanda,
Yes,
please?
if, for example, the teeth that you already have,
Mm-hmm.
are they able or prepared to accept your new crown?
If you already have crowns, or are you natural?
It says that the current teeth,
Your current teeth.
so I'm thinking the teeth that, well, your normal teeth, if they are able to accept the new crown that you will have.
Yes, of course. I mean, even if you already have a crown there, if everything goes well with your tissue and your gums and everything, and your your root is strong enough, we can put another one.
Okay. Let me see. Okay, so we have an attendee that says that they're a heavy grinder. So how long will the zirconium crowns will last? And how long will the porcelain fused to metal last?
If he's having problems with the bite, that's what I understand.
Yes, like he's a heavy grinder, like
Oh, okay,
because
okay, okay,
yeah.
okay, got it. Um, of course, probably. Okay, we need to make a night work for you, so that way you don't brush your teeth in the night. But I mean, I want to say yes. I want to say yes because should be with the nerve work, you can fix that problem.
But they will last the same, the crown.
Of course, the probability of success and the long term, it can change, of course, because you know for your bite for occlusion, but we can make an eye guard for you, and they can take a lot. Like, I mean, if you take care of them well, I don't know, 20 years.
Okay. Let me see. We have any questions? Okay. This is so interesting. Why are crowns so expensive in the USA compared to Mexico?
I don't know, guys.
I do want to comment on this one. Normally, crowns are expensive because normally universities here in Mexico, they give you, or they give the people, the government, as a subsidiary, so we don't have, or the dentists don't have as much of a debt with that university. So they will be able to finish, their studies without having so much debt, and they will be able to give prices according to the market here in Mexico. Plus, the way of living in Mexico is much cheaper compared to the United States. That is why we have different prices between the United States and Mexico with dentistry. But it's the same quality, or would you say it's a different quality, Dr. Marla?
No, I mean, honestly, I want to say, I mean, of course, in the United States, dentists are great, but let me tell you that I mean, it's more affordable here, and it's the same quality, the same material, and one of the doctors in the clinic are like with a very high profile. They are went to some I mean workshops in Harvard or Berkeley. So and one of our doctors, it was made at this uh, workshop in South Africa and Germany, and so yes, we have a
Yeah, we
lot.
have Korea, Israel too, with implants.
Yes,
Wow,
so
they're
that
so prepared.
yes.
Okay, and wow, great question. Do you need to worry about language barrier between the dentist and the patient?
Uh, okay. the information that I have is that all of our doctors speak English very well. Um, Sometimes, let me tell you guys, don't be so hard with us. Um, Sometimes it's very hard to explain. You know, all these concepts that you already know in Spanish because it's a medical language, so it's hard. But all of our doctors speak English, and if not, you get a patient coordinator who are very, very, very good English speakers, so they
Yes.
can explain you everything.
All of our staff is bilingual, guys. So you
Hmm.
don't have to worry about a language barrier.
Hmm.
Okay. So we have questions about prices. Let me see if I can get those questions. If not, you can check the prices at sunnydentalgroup.com. We have the price list available for you, so you will be able to check the prices as well. And well, we have open prices for you guys. We don't want to hide anything from you. So if this could be useful, you could review the prices for each and every dental procedure that we offer at Sunny Dental Group. And I think we have time for one more question. What do you say?